Hey y'all, Kayla Mowdy, Doctor of Physical Therapy here with another Monday educational moment. Today we will continue our series in pelvic health and I will discuss pelvic pain. Specifically pain located in the pelvic floor muscles. There are a lot of other things. Most people who have pelvic pain also have hip dysfunction or low back pain or history of low back pain. All these things tend to kind of go together. But specifically pain of the pelvic floor muscles. These can be brought on by lots of different things. We hold tension here in our shoulders and we get trigger points in stressful situations. The pelvic floor in the brain is actually located right next to the emotional center. So these things tend to actually go together. Some people have a history of difficult vaginal deliveries, but that's not always the case. Some women, when the change of life happens, have some hormonal deficiencies or irregularities that can cause some pain or change in the tissue in this area. Men, pelvic pain for them is manifested in either difficulty with erection or ejaculation or pain with these things, or I've seen pain with urination as well for men whose pelvic floor muscles are actually too tight. So in the last couple of videos we've talked about the muscles not working well. A lot of times the pain is associated with the muscles being too tight or having trigger points, and this can come from lots of different things. Some of them just come from bad bowel and bladder habits, so straining to use the bathroom, hemorrhoids, lots of things that can go wrong in that area that lead to pelvic floor muscle dysfunction and pain in this area. So don't be afraid to talk to your doctor about these things. That might be what I want to encourage most with this. These are things that need to be screened, and there could be other sinister causes. And a lot of times doctors can rule these out, and then a lot of times they don't know what to do after that. After all of the medical things have been ruled out, it's not a urinary tract infection. It's not prostate cancer. It's not organ prolapse, which is a sign of pelvic floor weakness. Whatever it might be, some people have history of extensive surgeries in the pelvic floor region, whether it be a prostatectomy for a man or hysterectomy for a woman, or hernia repairs, meshes, bladder tacks. Doctors like to just fix things down there, and sometimes that leads to scar tissue and pain, and things aren't sitting in the right place. And this can be very difficult and cause pain during intercourse or just regular pelvic floor functions that are all very important. So if you're having pain in this area, I just encourage you to talk to your doctor about it. You might have to seek out a specialist as far as a urologist or a gynecologist or something that can do a little bit further testing and make sure you don't have anything going wrong in this area as far as infection or medically related. And then you can seek out a pelvic health physical therapist in your area to begin learning ways to do the proper breathing techniques and relaxation and stretches, and maybe even some muscle work and muscle release in this area, and getting the bowels regulated, and lots of things that we do and encourage to start having a healthy pelvic floor. Next week we'll talk about the pelvic floor's role in stability of the hips and back. Bye y'all.